Welcome to Section 1, The Price We Pay. A look at healthcare costs. The United States spends more on healthcare than any other developed nation. Yet, millions of Americans struggle to afford basic medical care. One heartbreaking story involves a young mother diagnosed with a treatable form of cancer. Despite having health insurance, she faced astronomical out-of-pocket costs. She was forced to deplete her family's savings, sell their home, and still could not afford all the necessary treatments. This story is not an isolated incident. High healthcare costs are driven by various factors, including inflated prices for drugs and procedures, administrative inefficiencies, and a lack of price transparency. The current system often prioritizes profit over patient well-being. It is imperative that we address the underlying issues driving these costs and work towards a more equitable and affordable healthcare system. Welcome to Section 2, Insurance Roadblocks, Navigating a Complex System. Navigating the American health insurance system can feel like navigating a labyrinth. Understanding different plans, coverage networks, and medical billing practices can be daunting. Many Americans find themselves struggling to understand their insurance policies fully. This complexity often leads to confusion and frustration, particularly when unexpected medical bills arise. Seeing a doctor outside of your plan's network can result in significantly higher costs. Deductibles, co-payments, and co-insurance further complicate matters. It's crucial to advocate for a more straightforward and transparent system that prioritizes patient needs and ensures affordable, accessible healthcare for all. Welcome to Section 3, Unequal Access Disparities in Healthcare Delivery. Access to quality healthcare should be a right, not a privilege. Unfortunately, disparities in access persist in the United States, disproportionately impacting marginalized communities. Factors such as race, ethnicity, socioeconomic status, and geographic location can significantly influence an individual's ability to access timely and affordable care. Studies have shown that racial and ethnic minorities often face significant barriers to care. They are more likely to be uninsured or underinsured and experience higher rates of chronic diseases. Systemic racism and implicit bias within the healthcare system further exacerbate these disparities, leading to poorer health outcomes for these communities. Rural Americans also face unique challenges in accessing care. Bridging these gaps requires a multi-pronged approach, including expanding insurance coverage, investing in community health centers, and diversifying the healthcare workforce. Welcome to Section 4, the high cost of staying healthy prescription drug prices. The United States grapples with exorbitant prescription drug prices, placing a heavy financial burden on individuals and families. Americans often pay significantly more for the same medications than people in other developed countries. For many Americans, affording essential medications is a constant struggle. High drug prices can lead to medication non-adherence, meaning people skip doses or forego treatment altogether due to cost concerns. This not only jeopardizes individual health outcomes, but also leads to higher healthcare costs in the long run. Addressing the issue of high drug prices is crucial to ensuring affordable access to life-saving medications for all Americans. Policy solutions, such as allowing Medicare to negotiate drug prices, increasing price transparency, and promoting generic competition, are essential steps towards making medications more affordable and accessible. Section 5. A system in crisis, the emergency room bottleneck. Emergency rooms across the country are facing unprecedented strain, often serving as a safety net for patients who lack access to timely and affordable primary care. While emergency rooms are essential for treating life-threatening conditions, they are not designed to provide ongoing care for chronic illnesses or address preventable health issues. This overuse of emergency departments leads to overcrowding, long wait times, and increased healthcare costs for everyone. Many Americans lack access to primary care physicians due to insurance limitations, physician shortages, or geographic constraints. As a result, they often turn to emergency rooms for routine care, even when their conditions are not emergencies. Furthermore, the closure of rural hospitals and the lack of access to specialized care in underserved communities exacerbate the burden on urban emergency departments. This strain on the system has far-reaching consequences. Addressing the underlying issues driving emergency room overuse is crucial, including expanding access to affordable primary care and strengthening community health centers. The United States faces a growing mental health crisis, with millions of Americans struggling to access adequate and affordable mental health care services. Mental health conditions such as depression, anxiety, and substance abuse disorders are prevalent and can have a profound impact on individuals, families, and communities. Despite this growing need, access to mental health care remains a significant challenge. One of the main barriers is the shortage of mental health professionals, particularly in rural and underserved areas. Long wait times for appointments, limited insurance coverage for mental health services, and social stigma surrounding mental illness further exacerbate the problem. The COVID-19 pandemic further highlighted the urgent need for increased mental health support. Expanding access to mental health care requires a multi-pronged approach, including increasing funding for mental health services and addressing the social stigma surrounding mental illness. In a healthcare system often focused on treating illness, preventive care plays a crucial role in maintaining health and well-being. Preventive care encompasses a range of services, including routine checkups, screenings, vaccinations, and counseling on healthy lifestyle choices. These services aim to detect and address health risks early on, reducing the likelihood of developing chronic conditions and improving overall health outcomes. Investing in preventive care is not only beneficial for individuals, but also makes economic sense. Screenings can detect diseases like cancer, diabetes, and heart disease in their early stages, when treatment is often more effective. Despite the clear benefits of preventive care, many Americans face barriers to accessing these essential services. These barriers include lack of insurance coverage, high out-of-pocket costs, and limited access to primary care providers. Navigating the American healthcare system can be daunting, but there are steps individuals can take to advocate for their health and make informed decisions about their care. Knowledge is power, and understanding your insurance plan, rights, and options is crucial. By taking an active role in your healthcare, you can potentially save money, avoid unexpected bills, and improve your overall health outcomes. Start by thoroughly reviewing your insurance policy. Understand your coverage, network providers, deductibles, co-payments, and out-of-pocket maximums. When choosing a healthcare provider, verify their in-network status with your insurance plan to avoid unexpected costs. Ask for detailed cost estimates for procedures or treatments up front, allowing you to compare prices and make informed decisions. Communication is key to navigating the healthcare system effectively and ensuring you receive the best possible care. Improving the American healthcare system requires a collective effort from policymakers, healthcare providers, and individuals alike. Addressing the systemic issues, such as high costs, unequal access, and administrative complexities, is crucial to creating a more equitable and efficient system that prioritizes patient well-being. By working together and advocating for change, we can create a healthcare system that truly serves the needs of all Americans. One crucial step is advocating for policies that promote affordability and transparency in healthcare pricing. This includes allowing Medicare to negotiate drug prices, requiring hospitals to provide clear and upfront cost estimates for procedures, and addressing surprise medical billing practices. Expanding access to affordable insurance coverage is essential to ensure that all Americans have the opportunity to obtain the care they need without facing financial hardship. Addressing social determinants of health, such as poverty, food insecurity, and lack of access to transportation, is crucial to improving health outcomes and reducing health disparities. By investing in community-based programs and addressing systemic inequities, we can create a healthier and more just society. By working together, we can create a healthcare system that truly works for everyone.